informed decision about pricing, protection, and resources allocation. By understanding the different types of cost and relationship between cost and output, businesses can optimize their strategy and minimize revenue. So let's go to see protection. Protection is a process by which different inputs include capital, labor, and land are used to create outputs in the form of products or services. So we have like cost. We are talking about cost and protection and production. So we have cost. Cost is a monetary value of goods and services purchased by producers and consumers. And we have like three types of cost: fixed cost and variable cost and semi-variable cost. So let's see. Fixed cost are ones which should not change and generally part of long-term agreements. For instance, rent and malpractice, premiums, capital expenditure, staff, salaries, buildings, maintenance, and utilities. This is a fixed cost. And the second one is variable cost, are ones such as labor or materials which change with sale value. Example of variable cost in medical practices include hourly laborers, medical suppliers, or the cost of suppliers that vary based on the number of patients seen or producers performed. The third one is semi-variable cost, and it called also mixed costs, have both fixed and variable components. A common example for this semi-variable cost is like mobile phone bills, which might have a fixed monthly charge plus additional cost based on usage. So, and we have like these graphs. The first one is the example of fixed cost, which is show the cost unit and the level of activity. And the second one is show the variable cost. And the third one is shows the semi-variable cost or mixed cost. So let's go to investigate how the company manages cost and protection process to remain efficient in a competitive environment. We took like this hospital, Lubaga Hospital, Uganda Matis Hospital, Lubaga, commonly known as Lubaga Hospital, is one of the oldest exist for over 100 years, being founded in 1899. Over the years, the hospital has built a reputation as a provider of affordable of mainly mid-level and low-level status. Vision to be state-of-the-art healthcare facility in Africa. Mission to provide suitable quality and compassionate health services to the community of goods gallery. So we have this company. It has like objectives and core values, which is respect for life and human dignity, justice, equality, and innovation, efficiency, patient center and quality care, integrity, transparency, and accountability, good good stewardship and commitment, teamwork and respect for each other, professionalism. This is the core value of this hospital. And we have the breakdown of the company, major cost components, including labor, raw materials, and overheads. And we took the example of like 5 years, and this is a breakdown of this hospital. So I will let my colleague to continue from here. And this is the income by sources. So he will continue. Thank you for listening.
Thank you, Suda. Can someone confirm you can hear me?
Yes, we can hear you.
All right, thank you very much. So like Suda said, so this is a breakdown of the major cost components, but I think for me what is important here for us to note is the total costs, which is around next slide. And then when you look at the income, it tells you that this is a profitable organization or business if you want, because 26, remember, was our total cost. But if you look at just the patient fees, it's already for 2021, 2022, it's already 25 billion, meaning the patient fees alone can almost cover the total costs. So, and if you add the other income, then that profit, and it's a profitable organization. So let's move on. So from the reading we did, but also looking at Lubaga itself, we realized that almost more than 80% of the costs in this industry of health service, more than 80% are fixed costs, whereas less than 20 are variable costs. And so it tells you that um, but that is true for these bigger organizations, bigger hospitals. So you'll find that these smaller hospitals will have to struggle. But in this context, since we are talking about Lubaga, then we are in the right context. Can we move on? So let's look at then the strategies that Lubaga Hospital has employed to reduce these variable costs and maintain profitability. Not variable costs alone, but generally the costs, and to maintain profitability while still delivering high quality, just like its values state. So number one of the strategies is efficient staffing and having the right staff that is required at a given time. And not just staffing, I mean having many staff members where most of them are doing nothing. So making sure that the HR department knows what number of staff is needed, so that then they don't spend much more on staff that might not be required. So efficient staffing has been one of the strategies. And they use these analytics to also forecast the volumes of the patients, so that if they know that Mondays is maybe a high flow, maybe Sunday is a low flow, so then they will tailor the staffing in that order, so that they don't have redundant staff and thereby increasing costs when they are not actually earning. So the second strategy is energy management. Because in hospital business, energy is a big cost. So that if you could mute, please. Because lights are always on, there's refrigeration services, there's heating thing. So power goes, energy goes, so fast. So it's important that you manage energy that energy. Also don't determine and a lot of energy is being wasted or is being consumed, so that then they understand what the issue is, and get strategies of saving in that unit. So then the other strategy is the supply chain optimization. Because Lubaga is a big hospital, it buys goods in large quantities. So because of that, then they are able to have the backbone to the backbone to negotiate with the suppliers so that they can buy at a good rate, which might not be the case with smaller clinics. And also because they know they track the inventory system so that they know when the drugs are needed and not just stocking and then some are stolen and others got wastage through through what's the word? I forget the word, but going past the date, the date that is supposed to be used, expiry, yeah, so that they don't expire. Then there's one above. Just go back a little. There's one. Yeah, so waste reduction, exactly. So waste reduction, just like I said, through effective supervision or using the analytics, then they are able to stock what they need and not stock what they don't need. We can move to the next slide. Um, then I take the next slide. And when we talk about the West, think about the drugs. You can think about even furniture and office settings. All that they just have to stock what is needed. Then technology and automation. And doctor said we should give the live examples. Before automation became a thing here in Uganda, especially in our hospitals, you know how we used to register at the front desk office, and then the front desk office has to take the papers to the, insurance cashier, and then to the triage, and then to the doctor, and then to the lab. All that is labor intensive. It requires you to have many staff that you have to pay. But with automation now, the systems that they use, you just register at the front desk office. Every other unit gets information by just a click of a button. So that's how automation and technology is helping Lubaga Hospital, for example, to save on costs and yet being efficient. Then pharmacy management, just like I said, knowing what kind of drugs you need and also tracking them so that they are not stolen, they are not there for waste, so that then you only spend on what you need, vis-a-vis just, you've seen in government hospitals where forecasting is not done well, and then they stock drugs that are not that is what Lubaga is not doing then. They forecast exactly what they need and the amounts they need so they can use them efficiently and not have a lot of waste. Thereby, they are reducing on costs and maximizing on the profitability. Then number 7 is cost-effective treatments. And this is mainly through encouraging evidence-based practices to ensure treatments are both effective and cost efficient. Because if they are not, and the patients have to keep coming back for reviews and all, they take time and they take more medicine. Because remember, reviews, when you come for a review, you don't pay the same time. That having patients coming for reviews gives you more business. It actually doesn't. So it's better you use cost-effective treatments and standardize most of these treatments so that then you don't fall in that cycle of spending more or earning less. And then also, educating the patients and engaging with them. So that's some of these diseases that can be prevented, can also be prevented. So like we said, being engaged with the patients. As yesterday, the other day I was at the hospital, and one day after they gave me a call asking me how I am, how I'm progressing, whether the drugs are working. That's engaging with the client, because otherwise, if they are coming, they're supposed to come for reviews, and you're not they will not come where you were expecting them. But once you're engaged, then you know whether they will come or not, and then you can plan better. And then outsourcing, instead of trying to do everything by yourself, where you might even incur more costs, Lubaga considers outsourcing for things like laundry, housekeeping, food services, so that they can concentrate on their core job, and then the other things can be done by people who can do them efficiently. And then taking advantage of other initiatives from government, from other donors, and then also motivating staff so that they gain more from the staffing and the supplies that come from the next. And then so when we look at operational efficiency and how Lubaga is managing its resources to increase productivity, it's more or less like what I explained before. You know what automation does? Because when you do that, like I explained, the efficiency in moving information around the hospital, the different units, is increased, and that means you don't spend more money and more time on things that can be done by a click of a button. And then the other second one is efficient supply chain management, just in time inventory, especially implements and reduces efficiency. So that, like I said, you don't keep what you need. So it's only when you need it and you need it in time that you get it and use it. And then employee training and development, definitely when you skill your staff and they do it efficiently, and thereby increasing the productivity at the hospital in Lubaga. Data is now a very expensive and very critical product, should I say, yeah, product, because everything is based on data. So it's important that you use data to forecast, maybe for your inventory or even for your staff. So by using that to predict how things might go is also important in increasing efficiency and increasing productivity. Then energy management, like I said, using energy efficient equipment so that then they don't spend much more power or energy, as is normally is the case with big hospitals. So if you're using these, how are they called, light saving bulbs, for example, that if you're using these refrigeration systems that have lower, I think they are called, are they also called watts or something? So that can save energy but do the work you need. And then outsourcing, like I said, let people who can do it better do it efficiently, and then you concentrate on what you do. So then by implementing all these things, Lubaga is able to reduce on its costs uh, 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 and increase productivity, just like we looked at the suitable. I now hand over to my colleague Danite to take you under the economies of scale. Thank you.
Okay. Thank you, Junior. Thank you so much for the wonderful presentation. So now we are going to see how Lubago Hospital economies of scale in order to increase its revenue and maximize its service. So first, let us see what the concept of economies of scale is. At least let's try to understand the economies of scale is. So economies of scale is the cost advantage that companies gain from increasing their output. So it's better to understand it using this example. So for example, we have a burger company or a burger let's call it a restaurant which runs burger chain with 10 with 10 restaurants across whole of Kirin, or let's say across whole of Kampala. So normally 500 kilogram of ground beef every month at a cost of $6 per kg. So this is for the 10 restaurants. But as the firm grows, it becomes very popular, and then it starts to open more and more branches or restaurants. So it's going to start purchasing beef from 500 kilogram to 1,000 kilogram because it's now it's very big. So the price of the beef that it was buying $6 per kilogram, now it has reduced to $4 per kilogram, which is but it has started purchasing in more bulks. So which in other words we call it purchasing economics. So the in other words the price of one burger has also decreased. Um, Also, another example, let's say we have a company which produces cars. So normally there are fixed costs in a company. So the fixed costs, let's say in year one and year two, they remain fixed. They each cost $100,000. But then in year one, it produces five cars, and then the cost per of producing one car was 20,000. But then when it starts to produce 100 cars, the fixed costs they remain fixed. And when it starts producing 100 cars, it becomes the fixed costs become distributed among the 100 cars. So the value of producing one car reduces to 1,000, which means we are reducing the cost, but also we are doubling and tripling our income. So the question that was given to our group was research whether the company benefits from economies of scale. So as we have, as my colleagues have explained, the hospital or the company that we've chosen is Lubaga Hospital. So generally, hospitals can they can reap significant economies of scale in several ways. So some of the ways that Lubaga Hospital particularly or specifically benefits from economies of scale is one, it does bulk purchasing, just like we have seen in the previous example with this beef. Lubaga Hospital purchases medical supplies, equipments, and pharmaceuticals in bulks. So this will help it to get the supplies in a very reduced costs, and it will enable it to save some money. And then shared services. By consolidating administrative functions, human resources, and IT support across multiple facilities, Lubaga Hospital reduces redundancy and lowers operational costs. And then also it broadens its services by specializing, like there is maternity or OBGYN services, pediatrics hospital services, eye clinic. So it tries to diversify or specialize its services so that so many patients will come to it. And by doing so, it's the same hospital, the fixed costs remain fixed, but different patients are coming. So this way, the revenue can be increased. And then another strategy that it uses is that it has a negotiating power. So it negotiates with different suppliers uh, or other stakeholders, which leads it to more favorable terms and rates of the different services that it gets, different medical supplies. Also, improved efficiency through employee training of scale allows hospitals to invest in staff training and development programs, ensuring a highly skilled workforce. So this can improve patient care and reduce turnover rates. So a company is as good as its employees. So Rubaga Hospital works on training, and safe service to its patients or customers. And also research, and it also works on research and development. So one of the priority areas of Lubaga Hospital to position the hospital as a health research center of excellence. So the advantage of establishing research and development in the hospital is it can lead to innovation in medical treatment and care, which can further enhance the hospital's reputation and attract more patients. So reputation, especially in healthcare, is very important. So and research is very also important. So through research and development, it can establish its reputation not only in Uganda and even worldwide, internationally. That way, it can attract more customers. And it also invests in technology. So the ICT unit in Lubago Hospital, as we have done our research, is that it handles the hospital management information system. It has telephony, television, CCTV, camera, land security, one system, meaning their security. So By leveraging these benefits, Lubaga Hospital reduces costs, improves efficiency, and enhances quality of care provided by using the economies of scale. And then the other question that was given to us was to suggest ways in which a business can further scale operations while keeping costs low. So we have we have so one is to expand telehealth service. So the advantage of telehealth service is that it reduces the need for physical space. So space is one of the resources uh, in any company, and it costs you. You need space for uh, putting your files for your papers at least. So by expanding the telehealth, you are reducing the cost that you are putting on space. So therefore, reducing the cost of your company or of your hospital, and then optimizing resource lean management technique to streamline process to reduce waste. So lean management technique is one of the techniques that we use in order to uh, reduce waste and use the available resources that we have efficiently. So using the lean management technique is also very helpful in reducing cost and avoiding unnecessary costs. And then technology, like we have been explaining it before with my colleagues, foster partnerships. Of course, it's good to collaborate with other healthcare providers for sharing services like lab treatments, and this can help distribute costs and improve service quality. Uh, Enhance workforce flexibility. This is also mixing full-time, part-time, and contract varying patient demand without the fixed cost of a large permanent workforce. And efficiency. So working on our employees is very important. Uh, and as has been previously important to preventive care in order to reduce the seeing more patients who are who are chronically ill because they don't increase our shared service centers can lead to significant cost saving and increased efficiency. Energy efficiency has also already been explained. And also, we have to be continuously because we don't have to be static. So we have to establish a culture of continuous improvement where staff regularly identify and implement cost saving measures and efficiency improvement. So we have to be dynamic and open to continuous learning and improvement. So by implementing these strategies, Lubaga Hospital and other similar hospitals or other organizations, they can scale its operations sustainably and keep costs under control, ensuring they can provide high quality care without financial strain. So this is our references. So thank you so much for listening. If you have any suggestions, you are welcome. Thank you.